My problem started about 7-8 years ago when I had a few falls while I was playing athletics, playing soccer, playing other games, and also when I was involved in a couple of accidents while driving a scooter, and then one time I was hit on the back by a car while I was walking down the street, and I got rolled over the car. And about 3 years ago, when I had a fall while playing soccer, I started having more constant pain. Well, the pain, it is right here.
Okay.
Yes, yes. And sometimes I feel pain going down my leg, and also pain in the knees.
Both knees.
Yes, both knees. It used to be more on this side of the knee.
Okay.
It started on the left side, and then I had therapy a few times, and after having therapy, I started having pain in both knees, and I started having pain in the right knee too.
Okay.
And I would get pain when I'm walking, or then I went to see an orthopedic doctor, and they took some X-rays, and they had me do an MRI of my back, and it came out normal, didn't show anything. So they wrote me some painkillers, some muscle relaxants, and that didn't help. So I was given an injection in my lower back, an epidural injection a year ago.
Okay. Yeah.
Yes, and it didn't make a difference. So the doctor said there's not really much that she can do for me at this time. So I went to see another doctor, and I took my X-rays and my MRI, and they wrote me a prescription for physical therapy, and the therapist said that my pelvis, it seemed uneven. One side seemed higher than the other. So the therapist had me lay on a mat, and she would pull down on my leg. She would sometimes pull on the right leg, sometimes on the left leg. One of the therapists said that one leg seemed longer than the other. I remember which one it was. She pulled on shorter leg, and her colleague pulled on the other leg. So I got confused myself on it seemed like they were not sure themselves which leg they needed to pull on.
Okay. Yes. Then you have been doctors in US, but also in Canada.
Yeah, I went to see one in Canada, but that didn't help much. She used some needles for
Acupuncture.
and acupuncture kind of thing,
Okay.
and that didn't really help much. Told me some exercises which I did regularly, but I didn't see much of a difference. I've been to one chiropractor.
So-
Well, the chiropractor didn't see anything wrong with my pelvis. Chiropractor said the pelvis looked fine, and he had me do some stretching exercises for my hip muscles, for my flexors, and for my hamstrings.
Did you tell him about your breathing problems?
Yes, I did, and he said he cannot understand, and he doesn't think the breathing problem is coming, where is it coming from, and but they didn't do anything with the pelvis, because he said he doesn't see anything wrong with the pelvis.
So that is lowest you can go.
That's the lowest I think.
You say it sometimes because now I see that you are leaning your right side more.
Yes, yes. And even when I walk, I feel like I'm turned to one side, and my one side is moving more than the other side. The right side seems to move.
So it looks like that you are leaning on the right.
Yes.
How about this breathing problem? You have been seeing doctors, give tests.
Yes. I saw a lung specialist. The X-ray done of my chest, had the CT scan done, and of my chest. Also had the lung, the function test. The first one was done. It came out normal. Then they had me do it with an irritant, which they said is to see for us if I had asthma, and that one came out normal too. Well, it seems very hard to breathe, and I get pain in my jaws, and I have a lot of pain and spasm in my ear and get headaches, and I feel like all my muscles around here, they get tightened and they get clenched up. It's really hard for me to breathe. Like I get pain right here when
Yes.
I open my jaw
Do you have muscle tension here?
yes, right here, in the back.
Right. You said that you have been doing a lot of stretching, but it doesn't feel good.
No, it makes it worse. Every therapist would say stretch and do strengthening exercise, and it didn't make any difference at all. It made it worse actually.
Yeah, the right side is longer.
Ei ole iso ero. Yeah, right side is longer. Kyllä on kuule jäykkä poika.
Täällä on todennäköisesti molemmat.
Niin, ja täällä on
Yeah,
molemmat
I think-
lampionnikamat on aivan liian korkealla.
So,
Eli
yeah.
siitä on molemmat.
Because left side is a little bit higher than right side, but
Joo, ei paljon ole eroa, mutta...
but it's funny. Left side is higher, but your right feet is longer.
Yes.
Breathe in, breathe out. Breathe in, breathe out.
And relax. No niin, kyllä ei pahemmin olisi.
Olisi vähän harvoin.
Muutama nikama siinä on, mutta... And same again. On se. Hyvä siellä. No nyt. Be relax. No tää on kallattimis.
So there's a atlas, I think.
Ne. Tekee ympyrää toi.
Okay, how do you feel? Do you want him to check your jaw?
Yes.
Okay.
All right.
This was really fast.
Yeah, it's very easy.
How do you feel?
Better. A lot more relaxed. It feels different. Yes, I feel I'm standing straighter.
Breathing.
Breathing's a lot better. I'm beginning to feel more relaxed. The shoulders seem more relaxed.
All right.
Hello.
So sorry, man.
Now, so you can go this far.
I can bend a lot forward than before, and
So how about the knee pain?
I didn't have any knee pain last night, and when we went for a walk at the afternoon, I didn't have any knee pain while walking. Didn't have to take a pain pill or anything. I was comfortable.
How is your headache?
There were no headaches last night. This is a really positive sign, and my ears felt very lighter yesterday. No sinus problems.
Do you have any idea now what was causing the breathing problem?
Well, I think it had a lot to do with pelvic impairment that I had, and once that was fixed and then mobilized my spine, that really helped to loosen up a lot of tension that I was having in my body.
So
Relaxed.
relaxed,
Yeah.
and you can move it.
I feel I can move it. I don't feel like I used to, where if I move it, it would seem like it would be going to one side. I feel I can move it straighter down and back up.
When was the last time you could do that?
Oh, don't remember.
Show me once more. When you were a child?
I feel like live again.
No.
It's just amazing. I mean, I can feel all my fingers, my arms, my shoulders, my legs, and
Okay.
everything seems so relaxed and just
And the breathing?
and breathing's great.
Okay. Are you sure that what Jouko did to you on Friday, it was worth coming here for?
What he did and what he did, I mean, it helped me a lot. And all right, I would like to say thank you, Jouko, and Yusik,
Yeah.
and thank you, Yusik, and of course thank you, Tony.